Excellent. Thank you, Michael. And now I'm going to hand the meeting over to Dr.
Okay.
Teresa Palmer.
Can I just mention too that if we might turn your sound off if you're making noise in the background, and we might also turn off the video if you're doing distracting things like eating, so that people, the speakers and people aren't distracted from the speaker.
Thank you, Matt. Okay, I'm going to now hand over the meeting to Dr. Teresa Palmer. She's our activism leader on Laguna Honda Hospital, and she is a professional geriatrician and has lots of experience with Laguna Honda and is doing an excellent job of leading our activism on Laguna Honda Hospital. So take it away, Terry.
Okay, I was going to give a brief summary of how we came to where we are now at Laguna Honda, but looking at the list of people who are attending, I think most of you pretty much know that. And so I'm going to rapidly turn it over to the speakers. I have three speakers. Michael Farah worked with Supervisor Melgar, who's Laguna Honda is in District 7. And Supervisor Melgar has asked for a committee of the whole to meet the Board of Supervisors on January 31st about Laguna Honda. Michael, if you could tell us where that's at, that would be good. And also what the Board of Supervisors are being told and what they've been able to do. Tony Chicotel is lead attorney at California Advocates for Nursing Home Reform. We need to know what residents who are under threat of discharge, especially if this threat does resume on February 2nd, can do, and what we can do as a community to see if we can stop the discharges and bed cuts. Dr. Alan Cooper will also speak. He has a lot of experience with seniors and disabled people in need outside of Laguna Honda. And of course, the lack of services to those people intersect closely with what's going on at Laguna Honda, in the sense that people who have no place to go from San Francisco General or from the streets end up repeatedly hospitalized at San Francisco General, and then may end up at Laguna Honda either appropriately or inappropriately due to lack of services when they were less ill. Okay, so that's enough from me. Mr. Farah, can you start?
Sure. So, good afternoon, everybody. My name is Mike Farah, and I'm legislative aide with Supervisor Melgar. Supervisor Melgar wanted to reactivate the hearing that we had previously. We had a couple of other hearings at the Board of Supervisors, and many of you know that the board met as a committee of the whole. So, unfortunately, at the last meeting, the last hearing, the hearing was filed, meaning I had to reintroduce the hearing at the Board of Supervisors at the first meeting back, which means I had to file a motion for adoption without reference to committee.
Can you speak up a little? Thanks.
Sure, I got other people in the office, but yeah, I'll try and speak up. So I had to introduce a motion for adoption without reference to committee to have another committee of the whole at the Board of Supervisors. The motion was introduced at the last board meeting. It'll be heard on January 24th. And then if that motion is successfully passed, which I don't anticipate any problems with, we'll have a full hearing back at the Board of Supervisors, the full board, on January 31st. The reason the supervisor did it is a number of reasons. One is she wants to make sure that Laguna Honda stays at the forefront of policy decisions that the Board of Supervisors is discussing in the new year. That's one. It has to be a top priority to make sure that we are dealing with this successfully as a policy issue and a budget issue eventually, I think probably. Two is there's new members of the board that have not been fully briefed on the issues of the board. So we wanted to give the opportunity for Supervisor Ringardio to have a brief and to ask any questions that he may have at a hearing setting. And three, obviously, we wanted to have the hearing before the February deadline to make sure that we are doing everything we possibly can to make sure that there's no transfers. We had been at a situation where 11 people lost their lives after the last round of transfers, which is horrific considering the amount of residents that were transferred and how many lost their lives. So we are trying to do everything we can to make sure that that doesn't happen again. And I want to hear from Laguna Honda what it is. We don't have a large list of scheduled speakers to make presentations at the board. My anticipation is we'll have Director Pickens make a presentation. And then, of course, the meeting will be open to public comment at the committee of the whole on the 31st. The time is scheduled for 3 o'clock. That's the time we've requested. It's also on a day when we will probably also have a committee of the whole regarding the housing element for San Francisco. So I anticipate it to be a very busy meeting, long meeting, with those two items, both probably encouraging quite a bit of public comment. And that's kind of where we're at as far as we're concerned with the Board of Supervisors. I'll be able to answer any questions people may have and things that people may want us to ask Director Pickens when we meet as a committee of the whole.
Can I ask you one question, Mr. Farah?
Sure.
And try to speak up a little. I think your microphone is slipping under your beard. I think, do you have any evidence that we're going to get a reprieve on those evictions?
I don't have any evidence that we'll have a reprieve. What I do have is the assurances from Laguna Honda staff that they are in continuous communication with the state about that. So it's not going to be, it's not like they stopped talking along the way, right? They're continuing to talk. I would be shocked if the state all of a sudden said, you're going to need to increase the amount of transfers for two reasons. One is they have a pending lawsuit against them, one, and two, it was so unbelievably unsuccessful the last time that I can't imagine that they would immediately put the pressure on us to make transfers again. But you never know, and we're trying to play. I'm trying to make sure that the supervisor knows that that's not something that we should let happen, to be honest.
Okay. Okay.
So I don't have I don't have a guarantee that that is not going to happen, and that is what you're looking for.
Right.
I'm looking to make sure that they're asked that specific question at the committee.
Good.
We have a question from one of our participants. I believe it's Karen Fishkin.
Yeah, that's
Hi,
me.
Karen.
Hi. I had heard, I thought that the city attorney was also involved with trying to get the parameters changed so that there weren't people being discharged. So that city government as well as Laguna Honda staff were working on this. Is that your understanding as well?
No, but I will try and track down that story today, to try and get an answer about what they're doing to make sure we're not in a position to make a lot of transfers come February.
At the January 10th Health Commission hearing, David Chu was in the process of composing a letter asking for an extension.
That's good to hear.
But has he sent it?
I don't know.
And what does it say?
Yeah.
And we still don't have the root cause analysis. The root cause analysis is being illegally kept secret. The action plan is being kept secret. And the revised closure plan is being kept secret, which is actually against the terms of the settlement. these,
So
okay,
two things I would suggest. One is I think we've got an ally with new President Peskin. I think that he's somebody who understands the issue. But I'd encourage people to try and reach out to Supervisor Engardio to make sure he understands the perspective of the Great Panthers as this issue goes forward.
Michael Lyon has a question or a comment.
Thank you. My question is, has the supervisor investigated anything about the possibility of declaring a public health emergency to be able to get out from under any kind of state or federal requirements to close?
Declaring a state of emergency is not the purview of the Board of Supervisors. It's something she could have a conversation with, probably with the mayor's office about. I've not discussed with her declaring a state of emergency, because to do so in a state where we're kind of not quite in an emergency, meaning we were probably in emergency before we got the reprieve, right? When we were continuing to have to displace people. Now we've got the reprieve, and I don't consider us in a state of total emergency where we are. But if we get that notice on February 3rd that says we have to, then I think that's something she would have a conversation with the mayor about for sure.
Thank you.
Michael, can I go on to the next speaker? And
may, I'm
there'll be
done.
time for questions at the end. Art, you have a question?
Yeah, I don't know if I should raise it now or later. It's about the question of secrecy and things being decided out of public view. There's been a lot of concern raised at the commission meetings about that.
Mm-hmm. Well, we're you mean transparency and sunshine and how those decisions are being made?
Yeah, the health commission goes into executive session quite a bit. And we feel like decisions are being made out of public view. And there's been some frustration about
So
that.
when they go into closed session, are they reporting out what was discussed, or in some way?
No.
They're not.
And we don't have copies of the root cause analysis, the action plan, or the revised closure plan. All of
Okay.
which are determined by this. David, I'm going to pass on your question. Let's start with the next
Well, with
speaker
Art, I think
and
that,
have
let me
questions
just
at the
answer Art's
end.
question. I think Art, that's something to bring up at the public comment section of the Board of Supervisors at the Committee of the Whole.
Okay, and when will that meeting happen?
It'll be happening on January 31st, as long as the motion for adoption without reference to committee is successfully voted on the 24th.
Thank you.
Yeah, January 31st at 3. Okay, next speaker is Tony Chicotel. He's the lead attorney with CANHR. Tony, if you could just address the issue of patients' rights, how we deal with it, what both the community and the residents can do if discharges resume, and any other thing you have to communicate about stopping closure and bed cuts.
Okay. Hi, everybody. My name is Tony Chicotel. I'm the senior staff attorney for Canner. I'm a lawyer who represents residents of nursing homes. That's my practice for the most part. I have a couple of updates. I had a meeting last week with Will Harris of CMS. He's part of CMS National in Washington, DC and Baltimore there. He says that him and his boss were in San Francisco last week, expressly to meet with Laguna Honda staff, management, and I believe DPH was also involved in the meeting. I think among many things, the discussion was about extending the pause. Now, please don't take this as an indication that there will be an extension of the eviction pause, but I think that's something they were talking about. I think the idea was CMS wanted assurances that things were on the right track at Laguna Honda and would feel comfortable extending the pause. I've not heard how those meetings went. I'll be reaching out for an update today or tomorrow. I would expect there would be an announcement from CMS. If they're going to extend the pause, it would probably be in the next week to 10 days. I mean, it's got to be. We're running out of time. So I'm cautiously optimistic that there will be an extension of the pause for some of the reasons that Mike brought up, that it went so horribly bad last time. It would be awful to start that process again. If there is no pause, if February 3rd comes, there's no extension of the pause, and Laguna Honda is sort of under the direction to re-engage residents for eviction, my advice and my work will all be directed towards telling residents and their family members and their decision makers to simply not go. I mean, that was my advice last summer, was mostly to not go. Now, if Laguna Honda comes up with a great alternative for somebody that's superior to Laguna Honda, by all means take it. But my advice will generally be, unless there's some awesome option that appears for somebody, to just stay, to tell basically Laguna Honda to get lost, and force them to push the residents out using an unlawful detainer process, because we all know that these residents have the right, all the same rights that tenants have under the law, to stay in their home unless a judge approves them to be forcibly removed. I don't think Laguna Honda is going to go anywhere near that. So my advice will be stay. What's that song from the 80s? Michael Jackson and Paul McCartney, stay, stay, stay. Oh no, it was say, say, say. So my advice will be stay, stay, stay. And I'll do everything I can to educate. I mean, if we got to write a letter and put it in the hands of the ombudsman and say, please hand deliver this to every resident in Laguna Honda, I'll ask them to do that. We'll do another town hall. We'll get word out through the media, hopefully, that people should stay in place. I want to give one more update. I'm working with a former resident of Laguna Honda in advocating for him to return to Laguna Honda. He was one of the residents who was moved out during the summer, and he desperately wants to return. And I've been working with CMS Region 9, that's the regional office in San Francisco of CMS, to get him back. Laguna Honda has said, we would love to take him back, but unfortunately our settlement agreement with CMS precludes us from taking any residents. And I'm arguing that it doesn't preclude you from taking any residents, it precludes you from taking new residents. And this is not a new resident. You did this guy dirty. You should make amends by readmitting him. And CMS they're kind of dickering around with this, but I'm going to keep pushing them and try to get this guy back into Laguna Honda. And I figure if we can get him back, then other residents who were sent out over the summer might have the opportunity to come back as well. That's it for my updates.
Okay, thank you. Next, let's hold the questions till the end. Next is Dr. Alan Cooper. And one of the things about advocating for Laguna Honda is we want to look at how the residents of Laguna Honda relate to other communities in need, and why the health department is under so much pressure that they would make the expensive mistakes they have made at Laguna Honda. And so Alan, want to take it away?
Okay, thanks for having me.
And introduce yourself, yeah.
Okay, who am I? Most of my career was at Stanford as a specialist in liver disease. As such, I work with a lot of people with substance use disorders, alcoholism, hepatitis A, B, hepatitis B and C, which are transmitted through needles. And when I retired, I decided to focus on people with substance use disorders, took some training, went to work for Health Right 360 and the Haight-Ashbury Clinic, got more experience than I had a personal issue, and couldn't work full time anymore, so I began volunteering at the MSC South homeless shelter, where the UCSF students established in the 70s what they call a free clinic for the residents. And we saw about 15 a night, and I worked about 2 nights a month for several years. So I talked to literally hundreds of homeless people and saw their problems. And a lot of them were older. 15% of the homeless are over 65. More are over 50, which is what some people advocate should be used for a cutoff for homeless people because of their heavy disease burden. And from that, I got myself appointed through my supervisor's office to the Oversight Committee on the Department of Disability Aging Services. And really, this is a problem for the Department of Disability and Aging Services. They are responsible under the Older Americans Act and the Americans with Disability Act of providing services to Americans who are either disabled or over 60. So everybody uses a different number. They use 60. And the first question I asked was, what do you do for homeless people? And the answer may shock you. The head of the department at the time said, we don't do anything for we provide no services for homeless people. And I said, why? And they said, we used to, but when HSH, the Homeless Supportive Housing, was created, they were supposed to provide all the services. They don't provide services. They really have focused on housing with very few services. They do some work with rent subsidy. So there are basically no services for very poor people, the poorest, people who have to live on a street or in a shelter. What are these services that DAS provides? DAS is a good organization, a good city department. Provides Meals on Wheels. It works with Department of with Muni to provide transportation and paratransit. Provides in-home support services, people to help with areas with activities of daily living, as well as some subsidies, guardianship. So these are the things that a nursing home does, with the goal of keeping people out of nursing homes and being able to give them the appropriate services. So that's what DAS does for everybody who has a home, but not for anybody who doesn't have a home. And a lot of those are the people who do end up in Laguna Honda, if they're lucky. I was a resident for a couple of years at UCSF, and I worked at San Francisco General. And of course, for us, Laguna Honda was the outlet. You had a patient, what are you going to do with them? Can't get them into Laguna Honda if possible, and they had the social worker. And so Laguna Honda provides a great service, but it obviously can't provide enough. How many people are we talking about? Well, the mantra is housing first, and there's a lot of focus on getting people housed so they can get services, so they can get treatment. Here's a problem. Margot Cushell estimates that we're in California short about 1 million units of way below market housing. San Francisco's probably 10,000 units below what is needed for that kind of housing. It's not going to happen tomorrow. They're doing a good job, particularly post-COVID, of picking up some of those hotels. We're talking about maybe a need for 10,000 units. So what do we do in the interim? Well, one thing is to try and get them into Laguna Honda, because that's an ideal solution. But obviously, Laguna Honda can't be everything for all people. One. Two, a cohort of those people who are on the street or in shelters And part of the problem at Laguna Honda has been, it's not appropriate for some of those people. People with severe mental health disorder, people with untreated substance use disorder who are actively engaged in using and in some of the activities that lead to it, are problematic in a congregate setting like Laguna Honda. They're often problematic in the shelters as well. And so they end up on the street. One thing we did then, several of us got commissioned to write a report, to do an investigation. We spent over a year, 3 of us, interviewing virtually every agency that provides services for homeless people and for seniors. And we concluded that if you don't have a house, you don't get service. We then sat down and came up with a number of recommendations, which included simple things like getting transportation for people in the shelter. Let me give you a vignette. One, I could give you a whole bunch, but I saw a fellow one night who had just been discharged from the hospital. He was schizophrenic, but was medicated and was quite conversant and rational, and a very pleasant fellow and easy to relate to. And he had had a bad infection in his leg, which is why he was in the hospital. And he got very depressed when he first got the infection, he had been using heroin in the past or opiates, took an overdose, ended up in the hospital. The overdose, then he had the infection, and he then got discharged because he couldn't get, probably they might have tried to put him in Laguna Honda, and he would have been a good candidate. But he was discharged with a fistful of appointments. The doc, his clinic, Tom Waddell up in the Tenderloin, prescriptions for Walgreens, which is a long walk if you have cellulitis and can barely move, etc. Someone to see a caseworker, which is what he really needed desperately. Should he be in Laguna Honda? He could be in Laguna Honda. He was totally tractable. He was easily treatable if he took his meds. He could probably go on medically assisted therapy for his opiate use, which seemed to be recurring. And he would have been a great Laguna Honda patient. For whatever reason, he wasn't admitted there. He was sent to a shelter. Now, I have to tell you, that's a step up in our modern society. Up until about 2 years ago, or maybe 3 years ago now, when the state passed a law saying hospitals can't discharge people to the street, they began discharging them to shelters. With hardly a good discharge for a man like that. And often I know people who are discharged to the shelter, they get to the shelter, they turn around, they get scared, they don't want to live, and they go right back to the street. So that's our problem. We need to come up with a way to care for these people, both in shelters and on the street, and some even in Laguna Honda, to get them into a position where they can be placed. He would probably have done okay in an SRO if he could have intense case management to make sure he got his meds and could get transportation, which he can get because once they're placed in supportive housing, they can get some of these services. Or even better still for him, because he was a sweet guy who might have trouble in an SRO. The best of all worlds to be in a board and care. Now, board and cares are disappearing, but they're great places instead of Laguna Honda if there's adequate case management. Let's see, what else did I want to say? So, just one other vignette if you like them. If you don't want to put a thumbs up quickly. But another night I saw an older woman who had just been discharged from the hospital to the shelter. She was in her 60s, as I recall. She had just gotten out for heart failure. And after about 3 days, she had a fistful of medicines. She couldn't remember what to take when. The nurse in the shelter clinic is great. He tries to help, does the best he can. She really couldn't walk down, and I think from that shelter to get to Walgreens, you basically have to walk. It's not an easy bus even. They once said they have a few taxi vouchers, but they don't like to use them, and it's cheaper for them to call 911 and get an EMT to take them back to the hospital. It's crazy. What is she going to do? She can't lie flat. She can't get a low salt diet. She would do okay, possibly in a board and care. She'd do fine in Laguna Honda, but she might not need it. She might like it there. She might not. She would certainly do well could do well when she's more mobile. So the bottom line for this is we need services for the people. One, to reduce the number of people going to Laguna Honda. And more importantly, we need services for the people who don't belong in Laguna Honda. Some of the people with serious mental health disorders could go to shelter if they have good case management, who can then eventually help them seek substance use treatment, or the same with substance users. Some we're going to have to find a way to treat on the street, and it's not undoable. Terry told me about her daughter who takes care of people on the street. I met another social worker who takes care of people. That's Terry's granddaughter, who takes care of people. And you meet them on the street, and you get to know them. And eventually, she's smarter than I am. That's for sure.
Yeah. Okay. So let's summarize.
I'm done.
Okay. Yeah. So basically, if you're senior and disabled, the services, especially if you're unhoused or marginally housed, there is nothing preventing you from being repeatedly hospitalized. There's not sufficient, and this is whether you're substance abusing, mentally ill, or you're just old and poor, or all three. And so there's a revolving door where you just end up at the hospital at San Francisco General and gradually get sicker and get discharged with a handful of prescriptions and appointments that you can't fill and you can't keep. Okay. So I think, thanks a lot, Alan. I think what we're going to do now is open up the floor to questions. Art, do you want to be in charge of that?
Okay, the first one up is David Williams. Go ahead, David.
Yeah, I want to thank you for this. I didn't hear all of Michael Farah's report because I had to leave the room. I had a phone call, but I did hear Tony Chickatel's. And my concern is, Tony mentioned that CMS met with staff and management at Laguna Honda yesterday. I think he said it would be very interesting to find out, A, what happened at that meeting, and B, it'd be very interesting to find out if the union was present or not, if SEIU 1021 or any nurses units or management unions were present, and what can be reported. And I raise that because SEIU 1021 at a regional meeting of the members in December, on December 15th, we got a report about Laguna Honda that there had been a CMS survey team in there from November 28th to December 16th. And then at some point, I think because of some kind of a incomplete response or slow response to a fire alarm, they put Laguna Honda on what they called immediate jeopardy, which to me sounds like immediate jeopardy. And that lasted until apparently the night before. They were supposed to stay through the 16th. The meeting I was at was on the 15th. Apparently they removed the jeopardy notice on the 15th with notice that they might come back at any time within 90 days unnoticed. So it is serious what's going on, and do we know what's going on in terms of CMS inspection and compliance, and what's going on in terms of in those terms, and what's being reported?
Is that question for any of the speakers? Or for Tony?
Any and everybody.
Oh, Tony, did you want to address that?
Yeah, so for the meeting between CMS officials and Laguna Honda and DPH, I don't know exactly who participated in the meeting. I don't know if there were union representatives there or not. I don't know what they discussed. I know it was for the purpose of kind of getting an update on where things stood. I don't know if it went well or poorly. And I don't know anything about an immediate jeopardy related to fire alarm or emergency alarm response. That
Immediately, apparently it was corrected quickly, but it was still immediate jeopardy, which under the terms of the settlement is a reason to not extend the moratorium on discharges, but it may have been corrected rapidly enough that they got away with it.
okay.
I think that's the case.
That's too bad.
Okay, Art, did you have, let's see, we have some other questions in the chat. The agenda for the Health Commission meeting today, 4 p.m. lists 88 policies. Are these going in the right direction? Again, I think, Tony, are you aware of that? There's this review of policies going on. I have actually reviewed the policies. I'm pretty good at nursing home policies. And it sounds like stuff that should have been done years ago that just wasn't. A lot of the updates are basic updates that should be reviewed every year. And there are some confusing and contradictory updates about substance use on campus. And they will be discussed at the meeting at 4, which I encourage you to go to. There is a Health Commission meeting today at 4. And the policies might be hard for people to talk about if you're not sort of don't have a nursing home background, but certainly the executive presentation and discussion of secrecy and discharges are important to address. Okay, let's see. Other questions? Art, is there anything you want to ask your question?
Yeah, is there anything we as activists can or should do to improve the likelihood of an extension to the pause? I think, Tony, you alluded to the possibility of a pause in discharges or transfers out, right? Is there anything that the activist community can do to improve the likelihood of that? Or should we stand back and just let CMS do its thing?
Oh, no, I think pressure on CMS, they're the ones making the decision on that. So Administrator Brooks LaSure, Chiquita Brooks LaSure, pressuring her, and HHS Secretary Javier Becerra, telling them that, we don't want a repeat of what happened this summer. We don't want residents sent out and subsequently die. And I mean, it's the lives of these residents are kind of in CMS's hands. And we're hoping that they will allow the residents to stay in place. What I told a reporter today was these residents are just clearly better off staying at Laguna Honda than being sent elsewhere. And if you care about the residents, you would want them to stay where they are. So I think pressure on CMS, more media coverage would be good. I think that would help weigh or push CMS to extend the pause. I mean, for me, it's a no-brainer They should extend the pause. I think they're doing it, they're gonna do it begrudgingly because they want to make sure that that Laguna Honda understands it's not in the clear. And they're not just gonna extend it every time because they're, using the residents as pawns, using the welfare of the residents as pawns. Laguna Honda has to shape up. I think they're gonna try to continue to make that message clear by only grudgingly giving the extension, but I think they have to give the extension.
Well, that's somewhat encouraging. Jeffrey Kwong, you wanted to jump in?
Yeah, thank you so much, and thanks for inviting me. I'm Jeffrey Kwong. I'm on the board of the Harvey Milk LGBTQ Democratic Club. Laguna Honda has a close, very important place in the hearts of many Milk Club members since Harry Britt spent his last days at Laguna Honda. And, as a native San Franciscan, I've had relatives there working and also been patients at Laguna Honda. So we look forward to working with the Great Panthers in activism and supporting you in all your efforts. Also a member of the Rose Pack Democratic Club. So getting the Asian American community involved also in supporting your efforts. Thank you so much. And thanks for the invitation. I'm learning so much.
Thank you, Jeffrey. Also, Joel Engardio needs to be educated. Michael Farah brought that out. He's Supervisor Melgar's aide. Okay, there's other hands up, Karen and Betty Trainer.
Okay, go ahead, Betty.
Yeah, okay. Yeah, I wanted to say that I was very happy to hear what Tony had to say. And in general, say, to stay, just say no, all of that, which, as you said, any thinking person would realize had to happen unless a resident requests to be removed and has services provided for them when they are removed. That's a different situation. And there are some people, residents at Laguna Honda, who may fit into that category. Obviously, the 50-something people they did do and the 11 who died were not in that category. But what I want to know is, and this is addressed to Mike Farah, will Supervisor Melgar stand behind that position and ask the board to stand behind that position, that if by any chance they reinstate the removals of patients, that the board will come out with a statement saying, we say no, and help in any way, like with the unlawful detainer, delivery of those to the patients, do everything that the Board of Supervisors can do to stop this insanity. Thank you.
Hi, Betty. So I can't guarantee the actions of the Board of Supervisors. I can barely guarantee the action of my own supervisor. So I will try and assure you that the reason we're calling this hearing is to make sure that we're exploring every means possible to make sure that transfers don't happen. The reason why we're having conversations today with the city attorney and with others and put this issue squarely in the front of the public eye with the press and the Board of Supervisors meeting is that so people realize exactly what's happening. And I don't think that consciously CMS will, I'm an eternal optimist. I think they'll do the right thing and I want to make sure that they will. But I also plan for the worst, right? We've already been through this once and, and so keeping it with the attention of all the elected officials would try and unite them against CMS if they try to make this decision again. So I think that's the reason for the hearing is to get us all educated, all united, and act with one front. I mean, if there was ever a unifying factor at the Board of Supervisors in San Francisco, it is Laguna Honda. Like I can't find an issue that they are so strongly unanimous on any other issue in the city. So I find it encouraging, and I'm pretty sure we'll be able to go where we need to go.
Karen, do you want to ask a question or make a comment? Karen, is your hand?
Karen,
raised?
are you there? Your hand's up.
Maybe we should go to Michael and wait for Karen. Michael, you're unmute
Thank
yourself.
you. Well, Tony Chickatel's remarks about were very interesting about this being converted from a healthcare issue to more like a house occupancy kind of fight. I was struck by Tim Redmond's aside in the 48 Hills article today, which said the CMS has an agenda of downsizing large public health institutions. We know CMS is trying to privatize privatize Medicare, but do any of us have any evidence that CMS has an agenda of trying to downsize large public health institutions?
Tony, would you have that kind of overview?
I don't have an opinion. I will let you know that I did hear that there was a large publicly run nursing home in Philadelphia that was recently shut down. I don't know if that's at all related in any way. And I know that CMS has discussed the idea of breaking down the population at Laguna Honda's nursing home into more, specific groups, so that maybe some of the younger residents with substance abuse issues would be in a different building or different facility from the older residents with more chronic health conditions, that kind of thing. But I don't know of a general policy for or against large publicly run nursing homes.
Melanie has written, there was a model for closing state mental hospitals in the 70s and 80s that worked fairly well. Everyone had a case manager, social worker, and psychiatrist in housing backup, and it worked, but it was expensive. Cut by Reagan because too much expense and too much government services. We just don't have the will to have such programs now. Historical note.
We have two people waiting to ask questions or make a comment. Susan Englander, unmute yourself.
Yes, hi. And actually, this is a follow-up to Jeffrey Kwong's comment. My name is Sue Englander, and I'm also with the Harvey Milk Club. I'm going to be presenting at the Milk Club tonight and asking the general membership to vote on a resolution that mainly asks for the Board of Supervisors to hold a hearing prior to the deadline. But I also wanted to have the resolution to address 3 points out of the 11 that are listed in terms of the talking points. And one would be the flow project, because I think, again, I think that is a very insidious and harmful way to deal with both homelessness and mental health. And also that the residents already discharged by force must be able to return. So what do you, how do you react to a proposal for a resolution like that? Anyone who's been, talking today.
Susan, is that question for me?
I think so.
Okay. Could you?
Okay. And I see Nanette Asimov is here. I'm glad she's here. Nanette, and I want to know if Nanette is going to be covering this for the Chronicle, because I was talking to a couple of friends of mine. Actually, we were all in the hot tub at the gym. And we were talking about this I know, yes, it was a lovely place to have a discussion, talking about this very vital issue. And they said, where has this been in the newspaper? I want to ask Nanette Asimov if she's going to be covering this for the Chronicle.
I am.
Okay, then.
Yeah, thank you for your coverage, Nanette, and thank you for coming.
I'm glad to be here. I really am. It's an amazing issue. It's a painful issue. So thank you all for filling me in as I listen to you.
Yeah, just one more comment for me. I have to go. I have to go because I have another meeting, but I will be at the hearing this afternoon at 4. See you all then.
Thank you. Karen, do you want to make a comment or ask a question? Karen, are you there?
Okay, okay, she's not, so, okay.
Can you hear me now?
Yes.
Oh, okay. Is that
I don't know
Karen?
why.
Go ahead, Karen.
I unmuted myself. I just had a question, and that was Art had mentioned the activist community, and it made me think, does CMS have any kind of local presence, or are their offices all in Sacramento?
That's Washington, D.C.
Now I can't hear you.
CMS has an office in San Francisco. It's the headquarters of their Region 9. The country's, I think, broken up into about 10 or 12 regions. California's in a region with Oregon and Washington and Arizona, I believe. And maybe Hawaii and Alaska. That's Region 9. It's based in San Francisco. So there is a very local presence of CMS. The CMS headquarters are in Baltimore.
Tony, could you put emails into the chat box
Emails for who?
for CMS and Becerra?
I wish I had their email addresses.
Okay,
So I'll put the names of the officials. I don't know how you would be best to
okay,
get
and we'll get that out to the members.
Norman, do you have a comment or question?
Yeah, I just wanted to know, what does CMS stand for?
Center for Medicaid and Medicare Services, or vice versa? Is it Medicare and Medicaid Services, or Medicaid?
Yeah, it's centers, plural, for Medicare and Medicaid services.
So
And of
that's
course,
federal.
Medicaid is the national version of Medi-Cal, and Medicare and Medi-Cal pay for 80% of the costs at Laguna Honda. The other 20% comes out of the general fund.
We probably should also mention that a Center for Medicare and Medicaid Services, Centers for Medicare and Medicaid Services is under the jurisdiction of the Health and Human Services Department. And the head of that department is Javier Becerra, who is from California. And his former job here was, I forget now.
He's
Wasn't
Attorney
he
General.
Attorney General?
Attorney General, that's
Attorney
correct.
General, yeah.
So we have a strong connection to somebody in DC who could be very helpful to us, theoretically.
Yeah, one of the rumors is that he doesn't want to show favor to California, but just like the rumor is that Gavin Newsom doesn't want to show favor to San Francisco. So that's discouraging. I don't know. Do you think there's any truth to that, Michael Farah?
No, I don't think that's the way elected officials think, to be honest with you. I certainly know that wasn't true. I think he takes San Francisco to task as much as he tries to help San Francisco. So I just don't think that's the way they think.
Yeah. Have you heard anything encouraging from the governor's office, Mr. Farah?
No, I have not I had a conversation with the governor about Laguna Honda at Christmas time, but it was brief, and he was fully aware of the situation. He's 100% keeping aware of everything that's going on in San Francisco, especially regarding Laguna Honda. In the beginning, when I first came on in August, I talked to the governor's staff about it, and they said, no, they're following it every step of the way. They were very concerned about it.
Okay, Art?
Yeah, I had a follow-up question for Dr. Alan Cooper. He said something toward the end of his presentation I thought was really excellent. He said the bottom line is that we need services to reduce the waiting line to get into Laguna Honda. and services for people who don't need to go to Laguna Honda. How can we do that? Do you have suggestions on what policies or decisions could be made to meet that bottom line of reducing the waiting line for Laguna Honda and providing services for people who don't need it?
Yeah, we do. We on the Great Panthers website is a link to the report we wrote, laying out the services we think could be provided in shelters and even on the street. What we had started to work with Gordon Ma to have a hearing, and he had committed to not only have a hearing, but getting some budget money to begin providing those services. It's not an expensive proposition. So we're now in the process of trying to come up with another coalition. I had been working with Honey Mahogany, who's became a friend, but she lost, and Gordon Ma lost, so our two main advocates lost. We're going to go back to, I block on names. We'll go to Preston now, who we've talked to his office once. He represents the Tenderloin, which is an important place. We're going to go to, the supervisor from the mission, who I know really well, is interested in helping. And we're going to start again pushing the supervisors to have a hearing and to demand that both the departments provide services. The sad thing was ECS, Community Services, had a proposal to do just that some years ago, which was turned down by DAS. And in fact, they lost their contract to run a shelter because they wanted to provide services. We have to change that attitude in the city. And I think the new head of HSH, who came from DAS, may be amenable. So stay tuned. Those who have contacts with supervisors, maybe we don't know Supervisor Melgar, but we may start hitting Mike Farah for an appointment to begin to educate her. It was a big loss when Honey lost and Gordon lost. But I think that's the route. And we even have a plot, sub rosa plot, for who would oversee that. Since the two departments are fighting, there ought to be a budget item in the mayor's office run by someone outside of the departments who would oversee providing these services. And we're not talking about a lot of money. Extending things, I don't want to do a long speech, but extending things like Meals on Wheels and paratransit and in-home support services to have a few people in the shelters won't cost a fortune. And we're trying to come up with a number. So that's where we are. And I will keep you informed, rest assured, Art.
Michael Lyon has a related question. You want to ask it, Michael? Or should I read it? Michael says, has there been any discussion of reopening the mental health rehab center for severe psychiatric patients to relieve the pressure behind the Flow project? Which I think, and he didn't say this, but I think the Flow project has been blamed for the problems that led to the eventual, situation of threatening Laguna Honda. But by having two different patient populations and Laguna Honda not being able to help both effectively.
Well, in principle, okay. Several years ago when Matt Haney and one of the other supervisors was pushing San Francisco Mental Health Now, the mayor was going to put a separate proposal on a proposition, and they came together and they passed, I think it's called San Francisco Mental Health or Health, whatever, has a name. It was supposed to have an office. It was supposed to have an on-call full-time psychiatrist. So yeah, the Treatment on Demand Coalition is pushing to get some of those things reopened. Some of that was working in the, when they had the center during COVID in the, on the lawn near City Hall. And I think those kinds of things are key. One thing that is helping is the new rapid response teams, which don't have police, but have mental health workers and people like that who can get in the street and start addressing those people and maybe keep them from, and they've managed to divert a lot of people away from the hospital, some of whom might well have ended up in the hospital. And right now the push is to put them all in jail. Stop harm reduction, and start arresting. The care court is going to, in principle, which is passed, it's going to start putting a lot of people into the judicial process without having housing or services for them, and they're going to end up in jail. So fighting against that is key, and pressing City Hall to implement the San Francisco Mental Health Plan.
And one of the things about the mental health rehab center is now being used as a navigation center. It's the actual physical site is now in use for lower level care, a navigation center and some kind of transitional care center, right?
Well, the original center is supposed to be on Howard Street in a building that the city uses. The mayor wanted it there.
Yeah, that's the mental health. I'm talking about mental health rehab, the building on the campus of San Francisco General.
Oh, the
Hummingbird, now it's used as Humming. And then there's a subacute psych facility where people can, get kind of chronic inpatient care to get back on their feet at St. Mary's, but the beds are pretty much always full, I think.
Yeah, the mayor talks about 400 mental health beds. As near as one, if you try and parse it out, there are maybe two. There are 40 at San Francisco General only, and then a bunch that they rent at the old St. Mary's.
Yeah.
So we need. I'm going to say something really nasty. The problem. This is a problem that comes about because people want low taxes. They don't want to pay for the things they want. You can get people off the street if you pay for it. So, either put up or shut up or lock them up. And they've chosen lock them up rather than raise taxes to provide services. That's not a nice thing to say, but that's what's happened.
Hey, Art?
I have a question for Nanette Asimov. Do you think that good journalism can cut against what Dr. Cooper just said by avoiding simplistic solutions when, people may throw up their hands and say, lock them up instead of a more nuanced approach? You represent journalism here today, and I really respect the job you do. What do you think that you as a journalist can do to provide the public with better information so they understand the problem and can propose better solutions?
Well, thanks for the question, Art. As a reporter, I can't express an opinion, and I shouldn't express an opinion, but I can do the best I can to listen to your opinions and to listen to what knowledgeable people have to say on the subject and write articles, as I have read many. I was just reading one from the San Francisco Public Press from July that was excellent. And so a lot of people are I think, doing a good job collecting what we know about what's going on at Laguna Honda and shining this kind of spotlight. And that's really all we can do, but that's a lot. I think putting it out there in public and so that everybody has accurate information. I've heard, listening to you all today, I've heard a lot of accurate information and helpful information, and I've heard some things that are speculative and perhaps not quite right. So putting this stuff together into articles that are helpful is what I think is a good thing to do.
Thank you. Matthew Holtz, you got a question or comment?
Yeah, with regard to providing services versus locking them up, I mean, locking people up is pretty expensive. Isn't it quite possible that it's more expensive to lock them up and therefore requires more taxes than providing services? Is it cheaper to lock them up than it is to provide services?
I think it probably is, but it's a lot easier. And one problem.
You mean it's more expensive to lock them up than to provide services?
I don't know that that's true. You know, you'd have to account that, but the biggest problem with providing services, there are apparently, the Department of Public Health has a large number of unfilled case management positions. And the last time I looked, the number of individuals per case manager was well outside of the accepted number for intensive case management. So it might be cheaper if they could get a lot more case managers. To do that, they'd have to raise the salary probably and make the working conditions better. And it's always hard to try and account out what it actually costs to lock someone up beyond. We're trying to get some numbers on what it would cost to provide the services we've asked for. So we're slowly working on that.
Well, be sure and take into consideration the fact that, I mean, if they get services, they could become members of society who are contribute to, paying taxes rather than just going through the turntable, the door, going in and out of jail. I mean,
one interesting study like that was there's something called the Job Corps, which started with the Peace Corps. I don't know if people are aware of it. It's out on Treasure Island, and it was run by Haight-Ashbury, so I worked out there some. And I looked into it, and when they were trying to shut it down in the, I think, 70s or 80s, the RAND did a study, a controlled study, to see, and they found just what you said, that they randomized people. You could go to Job Corps, you can't, let's see what happens to you. And they found that people who went to the Job Corps got services, and part of the Job Corps gave people services. We gave them medical services and, vocational. They more than made up for the expense of going to the Job Corps, which was not cheap, in lifetime of taxes, less in incarceration and things like that. You can find that study in the literature. So yes, I mean, doing the right thing can be cheaper. It's not popular. I don't know why. It's easier to say lock them up.
I think it's kind of time to summarize where we're at. And so if each speaker could kind of hit the to-do and the summary points. I'm going to say, please attend and testify at the Health Commission meeting at 4 today. And okay, next, Michael Farah, what would you like? What are your points that we could be doing?
Well, I think we're doing it today. I think we're all raising each other's awareness of where we are in the issue. I think we're all focused on the message of where we want CMS to hear what our desires are regarding relocation. I think Laguna Honda will hear people speak at the commission tonight, and they'll hear people at the from the Board of Supervisors, making sure they understand, they know what the priorities are for the city. You know, and one of the things that's important for us, for me, is to, you know, if it wasn't for you, right, we wouldn't, I'm not sure it would have gotten the attention that it did, or it continues to do. So we need your advocacy as much as you can possibly give to this project, because without it, I don't know where we'd be.
And you also suggested that we educate the new supervisors, Matt Dorsey and Joe Longardio.
Well, Matt's been there for a couple of hearings. I think it helps, you know, every advocacy group in the city should always introduce themselves to a new supervisor. I think he'll get up to speed. I've met his staff. I'd be more than happy to introduce you or any of these members to his staff as well. And, you know, it's, again, Laguna Honda is an issue where it's not, even though we're the district supervisor, right, constituents from all over the city utilize this hospital. So it's not really a district issue, even though it's it lies in our district.
Okay, so you could help us set up a meeting with Joe Longardio?
100%. That would be very easy to do. And
okay, we'll work on that.
Great.
Okay, Tony, are you still with us?
Yeah.
Tell us what to do.
Two things. Until we get an extension on the pause at from the transfers at Laguna Honda, I would assume that we're not getting one. And so if this is an activist group, get active and hit up those CMS officials with letters, phone calls, emails, however you got to get in touch with them, telling them that we need to extend the pause. They need to stop hanging that over the head of the Laguna Honda residents. And then if we do not get the pause, I would be surprised if we don't, or the extension. But if we don't get the extension, then I think it's time to pivot, and we have to rally all the residents and their decision makers to stay in place and not be subjected to the inappropriate discharges and transfers that we saw last summer.
Okay. And do you have any wisdom to share about the bed cuts?
No, other than I think that that's a lost cause. That's my personal opinion.
That's discouraging. Yeah. Okay. And Alan.
So there are people who have rightly been identified as not belonging in Laguna Honda. It is the job of agencies like the Department of Disability Aging Services, Homelessness Supportive Housing, DPH, and the Metropolitan Transport Association to start providing services for those people rather than trying to dump them from place to place or have them end up either on the street or in jail with no services. So we have to push the city, the mayor, and our supervisors and those department heads to stop saying it's not my job.
Okay. Okay, and we have a spiffy new website, sfgraypanthers.com or .org. And we will try to keep the Laguna Honda call to action updated, and in the next day or so get notes in from this meeting and with contacts. And we will try to arrange a meeting with Joe Longardio. We will encourage people to email CMS. We need people to testify at the meeting at 4 today. And we need people to testify at hopefully the Board of Supervisors meeting on January 31st. And there is some talk of a rally in front of on Laguna Honda Boulevard in front of Laguna Honda on February 2nd. And we haven't really begun to organize it, but it's something to consider if we're not getting reassurance in the next week that the discharges are going to be extended. Okay. Any other questions or comments?
Thank you for organizing, Teresa.
We have Norman Degelman's got his hand up.
Yeah, I just wanted to know, what should we say at the meeting today briefly?
I think the main thing is that we need more transparency, that discharges cannot continue. We need your policies and procedures to be up to date so the doctors and the nurses understand how to cope with situations that have gotten Laguna Honda into trouble in the past. Clarity on these policies, and we need management that is sophisticated about nursing homes. Right now, management are all acting management from other parts of the San Francisco Department of Public Health. They are not nursing home administrators and nursing home managers, except for some of the nurses.
Okay, thank you.
Can you put the talking points in the chat for to give?
Yeah, I'll try to do it during the membership meeting.
Okay, so
So at 2:30, we can take a 5-minute break here. At 2:30, we will, or 2:28, I guess 5 minutes, we will begin the membership portion of our meeting